Okay, so hello, I'm Irene Buteman. I'm the Place and Wellbeing Partnership Lead at the Improvement Service and Public Health Scotland. And today's third masterclass in our series is on data. And more specifically, as it says there, it's on data on inequality to help shape more preventative decision making and the role that it's played for ourselves in the Shaping Places for Wellbeing programme. The Shaping Places for Wellbeing programme has been running for 3 years, and I've been leading that, and we've got members of the team here today to help with any questions that come up as we focus in on data. What I'd like to just start with today is a little bit of the context that we set in Masterclass 1, because that explains where data sits in both taking any place-based approach, but specifically also in taking the Shaping Places for Wellbeing approach. Then I'll get into the why and the how of that data and what we have done. And then we'll end by having a look at the impact that the data has had and what support we have available for anybody looking to take a place-based approach in general and looking at how they go further and capture the kind of data that we'll be talking about today. So to begin with then, Masterclass 1, and just to give that overall context of what we covered in that, and I encourage you to watch it if you want the fuller detail, obviously. But what we covered was what we meant by when we talk about place, because there's a lot of talk around place. We went into what it was and why it mattered and the impact that it's having and can have far more of an impact on reducing inequalities across Scotland and having a real preventative impact on the spend within councils as well. We also went through what it means to take a place-based approach, and then we went into more detail really on what the Shaping Places for Wellbeing programme approach had been specifically around place-based working and the support that we had given across Scotland. What we highlighted at the very beginning of that anybody looking to take a place-based approach doesn't sit in any one sector. It's all of us, essentially. For ourselves, this has been the Shaping Places for Wellbeing programme has been jointly delivered by the Improvement Service and Public Health Scotland. But taking that approach is something that is there for all sectors that are stakeholders in a place, including communities. And nor does place sit at any small geography. It sits up there in strategic decision making just as much as it can sit up as Scotland being a place as well. And what we highlighted that brings us to where we are in this masterclass today was that there were three key parts to taking a place-based approach to any decisions that we are making, to our decision-making process on plans, strategies, proposals, whatever. If we want to take a place-based approach in those decisions, then we need to be looking at people and what they are experiencing in that area. And we also need to have an understanding of all the features that if we get them right in a place can have a very positive impact on those people. Stems right back to social determinants of health, the place principle, and the impact of the places that we live on reducing our health inequalities in Scotland and improving our well-being. Within the Shaping Places for Wellbeing programme, that is involved looking at data, looking at the quantitative and qualitative data that tells us what people are experiencing, because if we don't know that, how can we set out to address inequality if we don't know what the inequalities are? For all the features around a place, using the place and wellbeing outcomes, and Masterclass 2 that Jen referred to earlier is already up on the Improvement Service website and can also be viewed if you want a little bit more of a deeper dive into those outcomes. And then the important aspect is that we bring both the data and the place and what we know about that place into our decision-making processes, so that when we're making those decisions, we're thinking about the impact we're having on all of our people, but particularly on those experiencing inequality, and that we're thinking about our impact on all of the place and wellbeing outcomes. And as I say, Masterclass 2 gives a lot more information around those place and wellbeing outcomes, whilst today what we're going to focus in on is that aspect of a place-based approach about people, specifically looking at that data, quantitative and qualitative data, and the importance of having both of them as part of the approach. So moving on then to look at the why and the how of data. I'll start with a little bit about the Shaping Places for Wellbeing programme. Started, as I said, 3 years ago with an overall ambition to improve Scotland's well-being by reducing the significant inequality in the health of its people while addressing the health of our planet. And there's a lot more in Masterclass 1 about those significant inequalities that we need to be addressing. We did that by using the place and wellbeing outcomes, creating system change and supporting change in local processes to deliver on the place and wellbeing outcomes, to deliver the places that help people to thrive. And what we did in that blue band along the middle is the activity that we took part in. And the more detail on that was we worked in 7 towns to support them to take a place-based approach. So the work that we did in those 7 towns around data is what I'll go on to. The other work that we did within the programme was we learnt from each other. With funding from the Health Foundation and Scottish Government, we were able to put in project leads and community link leads in each of those towns who then met, reflected and learned from the processes that they were going through to support, which has meant that we now have the vast array of support on our website and the how-to guides that I'll be referring to during this presentation as well. And then finally, we also had a national leadership cohort that we fed up into with local issues that were becoming more of a national issue. And you can see the organisations there, and we met regularly with them throughout the period of the programme as well. So looking specifically then at those project towns and what we did to support that element of a place-based approach around data, we kind of start with that thing about what we have when we look at a town. The first thing we have is we have populations, and that's in many cases the very first thing that we look at in a place. And as we went in and worked in all of these 7 places, they had been deliberately picked so that they would have a range of size of town, a range of being rural to being very, very urban. And they were all areas that were experiencing deprivation within the SIMD index. And they were all willing to work with us as well. And that was our criteria for going in and selecting these towns to work with. What we found when we got to data was that there was a very different story in all of them. Some had an awareness of the inequalities specific to that town. Some had only a general awareness and far more specifics around the council area as a whole. So in some cases, we were bringing new information about data. In some cases, we were giving them a sense check of what their data was telling them. But nevertheless, important that it has that focus on inequality and that it also pull out those main population groups that are being impacted and the ongoing approach that we had to then sharing that and bringing it into decision making, irrespective of whether we were simply confirming or introducing new data. So the data journey that we went on covered 4 key areas, but really split into that emphasis that I've already given between quantitative data, the factual stuff that can be provided through an array of different sources, but it's actual facts and quantitative. And we pulled together data profiles in all of our towns with the help of the local information support teams that sit within all of the health and social care partnerships across Scotland. So that analyst support that sits there in all of Scotland was what helped us in each of our towns. What we found also was what helped with bringing that into decision making was having an infographic around what are those key population groups that are experiencing inequality. And then we turned and looked at qualitative information and we sense checked those key areas of inequality with those population groups, the people that were working with those population groups that were impacted. And again, we then pulled that into a qualitative summary with a lot of visuals. In every case, you'll see here that data is fantastic, but bringing it to life for decision makers is so important if we want to take that place-based approach. And we use the insights from each of these processes to inform within Shaping Places, our place and wellbeing assessments. That's the subject of Masterclass 4 in about 3 weeks' time, and also fed it into place and wellbeing outcome papers. So I'll touch lightly on those today, but not in a lot of detail, because there's a separate masterclass that will delve more deeply into those. So what that provided for us in all 7 of our towns was a data profile. So anybody wanting to really dig into what the data was saying could do so. And then an infographic, which very much pulled out the high level messages. A community link lead report, again, a lot of detail there for anybody wishing it. And then a summary that was much more visual, that was more shareable with decision makers. And if you think about all of the range of decision makers, community, third sector, elected members and so on, it was bringing data to life for them. But I want to go in first now to a little bit more detail around how we collected that quantitative and that qualitative data. Now, both of these are set out in two different how-to guides on our website. So I'm not going to go into full extensive detail, but just a kind of a flow and a flavour for what's in those documents, if you're wanting to take that approach to capturing both types of data. And I would have to highlight that for us, it was absolutely crucial to have both. Simply having one is not enough to fully take account of what people in a place are needing and feeling about that place, and to make sure we're not having a negative impact upon them when we're making our decisions. So when we're looking at that quantitative data collection process, we began, as I said, working with the analysts that sit within Public Health Scotland, but also sit within our health and social care partnerships in Scotland. And we asked them basically who is most impacted by inequality in the area. Tell us the top four to five population groups most impacted by inequality. What they did, because, as I said earlier, we were looking at towns, not whole council areas. So local outcome improvement plans will have data covering entire council areas. But what we were looking for was more local data to the particular towns that we were looking at. Then the very first part on that journey, from that first box leading over to what stands out, was we needed to define the geography of what we were working with. For somebody like me, who was not data literate at the time, I then learnt terms such as intermediate zones and the importance of finding publicly available data, but being able to match it to the towns that we were working with. So what we used throughout was intermediate zone level data. That got us local enough while still allowing us to have mostly data that we could share. At times in the likes of Alloa, that was easy. There were 4 to 5 intermediate zones that covered Alloa. But in some areas it was trickier, where you've got an urban area like Clydebank. There was a decision of which intermediate zones best match what the community class as being Clydebank. So it was important to bottom that out at the beginning of the process of deciding to collect this data, was actually what were the zones that you were going to be including. So what that gave us was what were the population groups that stand out. And if you can see from that diagram there, over to the left, we highlight in an oval publicly accessible data. And from the beginning, that was important to us, that this was data that anybody would be able to go in and source and do this process. Would an analyst help? Yes, it certainly would. But this data is available to anybody to access. And the arrows that are pointing into that oval around publicly accessible data highlight the key sources of population information and data that we consistently used across our towns. There were some other areas, but these were the ones consistently used. Now, the reason that they're in there as, Department of Work and Pensions, Public Health Scotland data, Improvement Service and Scottish Government data is because the profile, the how-to guide sets out exactly what those data sources were. So if you're wanting to review, see if you've used them yourself when you've been capturing local data, say in an evidence report, whatever, you can check that how-to guide and it lists what they are there. So having got to that point with the help of analysts to identify what are the population groups that are standing out here as being impacted by inequality, we then sense checked that with our steering groups. They helped by suggesting any local data that they felt could enhance what we already had around those key population groups. And you can see there the kinds of data from health and social care partnerships, council housing data, some GP data, but we did have issues around accessing GP data, and other examples around education and so on. But overall, through that process, what we did was we got to that point of having that final profile document that highlighted and drew out 4 to 5 key population groups that were impacted in that town by data. Now, how did that help us? Well, if I put up this example from Ayr was an example where they were not aware of this local level data purely for Ayr. They did have data for across Ayr, but being able to highlight to them that the quantitative data was showing that there was a geographic split of life expectancy of 14 years if you were living in North Ayr or South Ayr was a huge impact for them. Equally, the early deaths in those aged 15 to 44 living in North Ayr were significantly higher than for the rest of Ayr, for the rest of South Ayrshire and for the rest of Scotland. Also, the data showed us things around the population groups of people with addiction issues being significant and people living in poverty, including a focus on children. So that brought to life 4 key groups that could be a focus for decision making in a manner that it hadn't previously been able to do for Ayr. As I say, some towns already had data like that and we were giving them that sense check of what their data was saying, but bringing it to life nevertheless has been an important part of the process. Not just highlighting it like this on a slide, but as I say, bringing it to life in infographics. Now, this is the infographic for Dunoon. And as you can see, there's rich data in there, there's rich information, but it's really pulling out the key snippets that anybody as a decision maker looking for grant funding, whatever, would be able to pick up and easily use, and that others would, and including our steering groups, would easily be able to share across their own systems as well. And we were working with councils and health boards, but our steering groups were made up of a full range of stakeholders who were then able to pass this data on and bring it into decision making in a manner that it potentially doesn't happen when it's sitting in a profile and a table and a spreadsheet. It certainly doesn't happen in my mind, and we found the infographics and that communication of data invaluable. So again, another just example of the way that we presented the data in a manner that folks could use it more easily. So when we come on to the qualitative data, that moving on away from quantitative, what did we do to garner that? We asked our community link leads first and foremost to have a look in the towns that they were working in for any existing qualitative data. So that's reports on previous engagement and consultation that had content relevant to that town. Again, we have a how-to guide that runs through the process that they went through to do this, how to literally Google that with the right search terms in order to see just what is there already on qualitative data on inequalities that could be getting used. I have to say in that in many cases, we found that engagement and consultation processes hadn't produced a report that could then be used, not just to feed back to the community, but to feed back to colleagues and other stakeholders. And that was an interesting finding for us, that there weren't as many of those reports as there were engagement and consultation processes that had actually been undertaken in the areas. The next thing that our community link leads did, though, was the crucial part around collating qualitative information that gathers insight on inequality. And they reached out to gather community insight through conversations with local practitioners and representatives of community groups, organisations and services. This was with the frontline staff that were working with those that were impacted by inequality. We know the struggles in reaching those that are actually impacted by inequality. Research tells us they frequently do not have the confidence to engage in consultation processes. So this was a deliberate approach to talk to frontline staff and to garner, first of all, a sense check of what was the quantitative data saying. Did people feel that was right? Did they feel these were the top 4 or 5 aspects and groups of populations that were being impacted by inequality? And then also capturing their thoughts on what were those population groups needing from their area? What were their thoughts on what they needed from the place in which they lived, worked and played? And we were able to then map that against the place and wellbeing outcomes into a full report down the bottom there, a full, again, detailed report of everything, and then also an easy visual summary. In both of these cases, we were able to use this kind of quantitative and qualitative data to bring it into our place and wellbeing assessments. But when we looked at the report on the qualitative information, it also informed more of a focus on inequality in future engagement and involvement and participation activity. An example being a third sector organisation having seen this, realising that they wanted to reach out and garner more information on those populations being impacted by inequality when they were in the process of preparing their local place plan. So it was giving people that awareness of that normal engagement processes still exist and still should exist and carry on, but there is great value in having a means to capture the qualitative information. And that doesn't have to then sit just to inform one plan or strategy. That can inform all decision making in an area, so can be an excellent resource for others as well. So that, as I said, fed into our overall reports, the full report, and then also fed into the summary report that was far more visual, that mapped according to the different themes in the place and wellbeing outcomes and pulled out crucial community insight on understanding and very rich information on what was happening in the area. In some of those areas, for example, in Clydebank, we found that the qualitative data really did have quite an emerging theme around the ability to move around in Clydebank, that was something that kept coming up for us, and that there was a disconnect between the town centre and much of the rest of Clydebank. Reflections about the high levels of poverty, which then was having an impact on low car ownership and dependence on public transport, and a kind of a round of information that came through about the affordability of public transport, the impact that was having on access to services and employment, the connectivity then between public transport and active travel, and then the barriers to active travel and public transport, and then finally both traffic and parking safety concerns as well. So a real theme came through in Clydebank around that particular movement area. That didn't always happen. Sometimes the things that came through were rich, but they were more of a spread across all of the place and wellbeing outcomes and the insight that we were able to bring into decision making. So as I've already said, there's sharing resources and learning resources already on our website on how to undertake that quantitative data profile, the qualitative data profile, and also, and this will be looked at in far more depth in Masterclass 4, how to undertake a place and wellbeing assessment guide that can then be taking on board all of that crucial data. So that's why I'm not going to go into any more detail of how we actually did it, because it is set out there for you. What I'd like to go on to now is a little bit more around the impact and then the support that is available moving forward for anyone wanting to take that place-based approach and make sure that they're considering all of the aspects of people. So when we look at the quantitative data and the impact, you'll remember me talking about Ayr with that 14-year difference between life expectancy depending on whether you lived in North or South Ayr. So this quote is from one of our Ayr steering group members, which says that the data profile was just fantastic. It was just what we needed to allow us to make those decisions at a community planning level, to make physical changes to the geographical boundaries that we worked on, and it allowed us to really have that data at our fingertips to say, this is why we're making decisions to focus resources in certain areas. The data gave us license and the opportunity to do that in a strategic way. So that was over and above our own use of the data in place and wellbeing outcomes. It was used to actually shape community planning and how they were set up around that in the area as well. When we look at the qualitative data, again, another insight from one of our steering group members from the Alloa steering group around the qualitative data on inequalities, remember, was that the report was insightful and powerful, and I think should be read and acted upon by anyone involved in delivering services to people in Alloa South and East in particular. It's an excellent piece of work. Now, the reason Alloa South and East is mentioned is because those were the areas that came out as experiencing high levels of inequality compared to the whole of Alloa, the whole of Clackmannan and the whole of Scotland as well. So rich information for anybody looking to reduce inequality whilst ongoing with any other work, they could have that insight on what it was that was happening and what those experiencing inequality were saying that they needed. So our own use of the data did, as I said, come into play, our use of the process called a place and wellbeing assessment. This is where we would do a half-day session assessing strategies, plans and proposals for their impact on the place and wellbeing outcomes, but also specifically for their impact on those population groups that we now knew were most being impacted by inequality. A full range of documents, that's only a short example of them. We're way over 30 now in the range of place and wellbeing assessments that we've completed. And in every case, we've been able to bring the varying population groups that are impacted into that conversation. And as that data has been developed, we've been able to bring them alive all the more and give perspectives on demographics of who has the most to gain from a reduction of inequality into that decision-making process. So that for us has been a crucial link between people and place into decision-making, is using that process. Another means that we have used has been through producing what we have been calling place and wellbeing outcome briefings. These began in Clydebank and stemmed from those, the highlight that I just made about the movement theme being something that really came through when we were talking to those giving us the community insight and ask about, could we pull together both the quantitative data about how people were faring, the qualitative, what they were saying about the place, and the place and wellbeing outcomes into one document for each briefing. And we began by looking at that movement theme, doing one for active travel, one for public transport, and one for parking and traffic as well. So, and we have in Clydebank continued now with them to do them for every single outcome. The impact that has had in Clydebank of having those briefings and pulling together the quantitative and the qualitative data again into another even easier to read document of about three pages long it's been a valuable starting point for an active travel discussion group to be set up. It's contributed to the Western Bartonshire Active Travel Strategy, raised awareness of the movement theme and the links to other outcomes and experiences of different population groups. It's informed funding applications, community engagement plans, and other plans and strategies through place and wellbeing assessments. It's also informed local funding priorities. It's enabled a greater understanding of the links between people and place. The change we make in a place impacts upon people. And the briefings were, after we began in Clydebank, were then picked up by all of our other project town steering groups, and they focused in on the areas that the data was telling them were the key outcomes that the population were highlighting as an issue for them. Those were the outcome briefings that we prepared for them. We haven't prepared a full set in every project town. We focused on the key areas that were coming out and the rich information that the qualitative data was telling us was an issue in areas. So to close then, where are we when we think about learning? Where we are at the moment is we have a huge website resource of not just the how-to guides that I've referred to, but also impact stories, blogs, and a lot of information just to give confidence to us all in including a place-based approach to our decision making, and specifically how to approach that aspect around data and the importance of having both types of data. We also have a national learning cohort, and these masterclasses form a key aspect of that, bringing people together to learn at the moment about what we've done and looking forward to what we do in the future. We also have some small, and that's why it's at the tip there, we have some small bespoke support around helping people with place and wellbeing assessments, with looking at certain documents around data. Your evidence report, has it got all the data that you need, for example? And we can still give some small bespoke support around that as well. As I say, we've had quite a lot of asks in the previous masterclasses around case studies. We have a lot of impact stories up there that can help with that, but I do think that that is something that we can bring to life in further masterclasses. Once we've completed this set of 4, we will be looking to the new year and running masterclasses that bring to life place-based approaches, using all of those elements and giving us all a little bit more detail and confidence in how we begin to pick that up and run with it ourselves. What is next for us is we will continue to expand and enhance the access to that quantitative data that can inform decisions across Scotland. And we're also looking to support the capture of qualitative data on groups impacted by inequality with a toolkit of options. So we took one approach, we are capturing any other approaches that we are aware of, and we'll be pulling those into a toolkit by the end of the year for others to use and select what would help them to get that rich qualitative information about inequality in their area. We've had challenges, we certainly have. Key ones has been the limited amount of publicly available data to identify the demographic detail on inequality. So we can, at times we can say this is the age group that are experiencing limited or reduced life expectancy, but that's not always been possible. And likewise, it hasn't always been possible to link that to it being which gender is experiencing it. We had hoped to do that to an awful lot more depth than we've been able to do. Part of that is also where we're looking in rural areas and sparsely populated areas, that there isn't the disclosure that allows us to have those data sources, so they have to sit at more of a local authority level. And another limitation that we have found across the board that we've reflected back up to our national leadership cohort is a limited access to mental health data, and also to the automatic access to GP data. We've found that we've had to go in specifically, and at times there are GPs sharing data in an area, but we could not assume that that was the case in all of the areas that we were working in. So to close, what can we all do? I would suggest that we all expand our own understanding of the importance of having both quantitative and qualitative data specifically on inequality when we're making decisions, because I would imagine all our organisations have an ambition there to be addressing and reducing inequality. If we don't know what those inequalities are, how can we take that into account when we're making decisions? I would suggest that you share this masterclass and the other ones as well with anyone that you feel would benefit from having that thought about a place-based approach in their decision making. I would ask that we embed consideration of data on inequality into all our plans and strategies and proposals, not just to local outcome improvement plans and locality plans. This is a job for all of us to be considering. Every housing plan, local development plan, economic strategy, health and social care strategy should be taking that into account. And I would also suggest that where we can, we use analysts. We do have options to access analysts across Scotland. As I said, our health and social care partnerships have access to the local information support team analysts. Now, it's their priorities are set by the health and social care partnership, but if you're part of that partnership, you're part of setting that priority. I was just hearing yesterday, actually, that a lot of local health boards now have analyst support as well. So there's another avenue there. And some councils still have analyst support. I know that that isn't the case across all of them. And finally, what I would ask is that you take a place-based approach when you're making decisions. If you're working on a housing strategy, housing alone and the delivery of housing is not the overall be-all and end-all. It is about thinking about all of the population groups. What impact are you having on everybody experiencing inequality? And what impact are you having on delivering all of the place and well-being outcomes? So those two little links at the top there are a source to a wealth of information to help and to give confidence to anybody who wants a little bit more information on data or on the overall approach. And you can keep in touch with us also on social media. So I would thank you very much for your time and I'll finish there. Thank you.